This video will be a part of a series of videos that will go over the material on the NHA excpt exam. This video will be going over the dispensing process, which is the largest portion on the exam, making about 43 questions on the exam. I'll be discussing patient profiles, SIG, and error-prone abbreviations in this video. Pharmacy technicians are going to have to do patient profiles. Here are the things that are important to be in a patient's profile. So patient's name, address, phone number, date of birth, gender of the patient, prescription drug insurance information, health conditions like if the patient has diabetes or hypertension, known allergies, are they allergic to certain ingredients in these drugs? These are very important to know. History of adverse drug reactions, and a complete list of current medications, including over-the-counter and herbal supplements. This should be updated each time the patient drops off a new prescription. SIG are the directions that the provider has written for the patient's medication. A typical SIG is composed of the following parts: an action word, so like take, give, instill, apply, place, inject. These are just a couple examples. A quantity with units, so 1 tablet, 4 drops, 1 gram. A route of administration, by mouth into the left eye, to the skin, vaginally, intramuscularly, and then the dosing frequency: once daily, twice daily, every 12 hours, every other day. Now, when the provider writes these SIG, the instructions for the medication that the patient is taking, they usually won't write those words completely out. Like for the route of administration, by mouth, you would have to know that it's PO. The dosing frequency, every other day, won't be written as that. It will be written as QOD. And these are things that you have to know, their abbreviations, and we'll go over that as well. Here is an example of a SIG. Take 1 tablet by mouth every day for hypertension. You need to be able to look at this and be able to break it down with the instructions I gave earlier: the action word, the quantity of units, a route of administration, and the dosing frequency. And then we'll go over some practice problems with these at the end of the video. The last section of this video will be the error-prone abbreviations. These are abbreviations that stand for one thing but are often mistaken for something else. The FDA and the Institute for Safe Medication Practices have teamed up to make a campaign to eliminate the use of error-prone abbreviations. I'll have a table in the video that you can look at, and you can kind of pause for yourself to look over the different kind of abbreviations that tend to be mistaken for something else. And these are definitely the type of material that can come up on the test. So this is the table of error-prone abbreviations. And these are some of the common error-prone abbreviations that are meant for one thing but are often mistaken for something else. AD means right ear, but sometimes can be mistaken as OD for right eye. AS, left ear, but often mistaken for OS, left eye. AU, both ears, but can be mistaken for OU, both eyes. And the same goes for OD, OS, and OU. They're often mistaken for the other ones that I mentioned earlier. CC, cubic centimeters, often mistaken for units. HS, bedtime, but can be mistaken for half strength or hour. BT, bedtime as well, but often mistaken for BID, twice daily. IU, international units, but can be mistaken for IV. IN, intranasal, often mistaken as IM, intramuscular. QD or QID daily can oftentimes be mistaken for QID, 4 times daily. QOD, every other day, can be mistaken for QD daily or QID 4 times daily. OD right eye can be mistaken as QD daily. SC or SQ can oftentimes be mistaken as Q, like Q for quantity. SS, 1/2, can oftentimes be mistaken as 55. 1/D, 1 per day, can be mistaken for TID, 3 times daily. UD, as directed, can be mistaken as unit dose. Per OS can be mistaken as OS left eye. So these are just some abbreviations you want to be aware of and to not make that mistake when you're a pharmacy technician. The degree symbol can also be mistaken for a 0. Here are some questions at the end of this video that will go over the different topics that we talked about today: patient profiles, SIG, and error-prone abbreviation.